All right, so today we're going to be going through a bit of an occiput motion palpation and then going through a adjustment as well. So to start off, I'm going to have my patient seated. To assess for motion palpation of C0, which is the occiput, and C1, I'm going to be using my index finger and my middle finger. I'm going to be placing it just along the mastoid, in between the ramus of the jaw and the mastoid. And first of all, I'm going to be looking for an increased space or a decreased space on either side, the right or the left. Right now I can kind of feel that there's a little bit of a closed space between the ramus of the jaw and the mastoid on the right side here. So it's kind of indicating to me that that would be right rotation of the occiput. But to make sure, I'm going to go through some motion palpation. So using my index finger and my middle finger, I'm going to grab the head and I'm going to place one finger on the mastoid and one finger on the C1 TP. And I'm just going to rotate his head, over pressuring on the mastoid, feeling for any movement there. And then I'm going to do it again with my middle finger. I'm going to be pushing on the C1 TP, feeling for any movement there. Then I'm going to repeat that on the second side with my index finger on the mastoid, my middle finger on the C1 TP. Rotate the head and over pressure with my index to feel the occiput, and then rotate the head and over pressure with my middle finger to feel the C1 TP. Next, I'm going to block the C1 TP and feel for strict rotation of the occiput. So I can find it here. Using my middle finger to block that C1 TP on the anterior side, I'm going to rotate the occiput there, and then block on the anterior side of this left C1 TP and rotate the occiput. So just by doing that, I can feel that he has a little bit of a restriction when he wants to go to the right side. So as we suspected, he's right rotated with a left rotation restriction. And then I'm going to assess for lateral flexion as well too. So again, using my index and my middle finger, going to be placing my index finger on the mastoid and my middle finger on the C1 TP. And I'm going to laterally flex him over my contact and just push a little bit L to M on that C1 TP, feeling for any listhesis of that C1 TP. And then I can also push down with my index finger as I'm over pressuring the occiput, feeling for lateral flexion of that occiput to see if it closes over top of my finger or not. And both sides feel relatively fine to me. So to work on that rotation, I'm going to have Josh lay down on his back here, supine. Should be good. So using an MP contact or an index contact, I'm going to be contacting the right side of his occiput. My patient's going to be supine. I'm going to be on the side of my contact. I'm going to laterally flex his head over, just using the headrest to kind of help me here. My indifferent hand is just resting on the side of his head, kind of cradling the bottom of his occiput a little bit. So what I'm going to do here is I'm going to slide down off of the occiput, right onto the edge of the mastoid, or the edge of the occiput, with my index contact. I'm going to further laterally flex his head over my contact. I'm going to slightly rotate away and get him to end range there. And then my vector is going to be P to A to stay on the contact and I to S with a little bit of a corkscrew motion and counterclockwise as well. And that's our video.